So one of the condition which is very common during pregnancy, and it does happen very frequently in Indian scenario, is the stretch marks. So what are these stretch marks? The stretch marks is when a skin shrinks or stretches in a short span of time, we get the stretch marks. Apart from pregnancy, where a woman's body bears a lot of weight, there is a swelling, there is edema, and there is increase in weight. Normally it has to be around 11-12 kgs, and occasionally somebody is carrying twins, it can go to 20 kgs. Now just imagine within 9 months the skin is stretching, and down the skin we have this elastin, the collagen, the fibroblast, these are the cells which are the matrix of the skin. So they stretch a bit and they tear, and on the skin we notice these linear streaks, and they give a very bad kind of an impression, and these are called stretch marks. And these are very common, happens mostly in lower abdomen and upper thighs, and around the, obviously it can happen around the breast area equally. But something is very catchy, it cannot happen in everyone. So it is somewhere the familial tendency is there. Certain women do get it because back there in families do have, her mother could have the same problem, and when she would have been pregnant and all. So it happens in specific families, but it's really very common. And apart from pregnancy, like gaining the weight quickly, or crash dietings can give, or sometimes in men or in women equally, where you go and do gymming and put on these weights and all, that can give these stretch marks around the shoulder area and all. Now what is the treatment for these stretch marks, and does we really need to get worried, and what to do actually? So all that you see in advertisements and on media and all, that the oils and all, these are actually fake things, and there's nothing scientific data which really supports them. And yes, there are certain primrose oils and things like that, but these actually promise but never ever deliver. And so normally as a stretch marks fades, it becomes, first it's a pink color, and it slowly settles down, it becomes the color of the skin, and then you attribute it to some specific treatment. It's because of that cream I had applied and now it's becoming better. No, it's a normal course. So skin is healing slowly. And but what can be done is, there are fractional lasers we dermatologists have, and even certain plastic surgeons do have these lasers, which are meant not for stretch marks, they're meant for other scars. But equally we treat the stretch marks with these fractional CO2 lasers. There are certain micro needling procedures which are done for stretch marks. There is some mesotherapy which is done for stretch marks, even for that matter PRP. So these PRPs are actually platelet rich plasma. Those platelets have the growth factors, and those growth factors trigger again the collagen and all the fibroblasts, the aminoglycans in our skin, and increase the matrix of the skin, and you can get a partially good response. But with all those treatment modalities available, don't expect like the results beyond 70-80%. So you can't remove them completely. Yes, it can get better, but never fall in a trap like don't get it removed. Just first complete a pregnancy and complete your family. So for example, somebody says, okay doc, I'm done, I have a baby and I just want to get rid of my stretch marks, shall I start the laser? And I say no, first are you done with your family? If you're planning to conceive again next year or coming years, then better you complete your family and we fix it forever. Otherwise, because the skin is going to stretch again, they are going to come again. So that's how this is the course of this problem called stretch marks, how we can take care of it.